Missing your period can be puzzling and stressful, especially when pregnancy is off the table. Today, we're diving into 10 less known reasons why your cycle might be off track. Stay tuned to unveil these surprising causes. Medical disclaimer: the content in this video has been fact-checked. It is provided for informational and educational purposes only and is not intended as medical advice, diagnosis, or treatment. Number 1. Stress. When we're stressed, our bodies go into fight or flight mode, triggering a cascade of hormonal changes. This stress response involves the release of cortisol, which can disrupt the delicate balance of reproductive hormones necessary for ovulation. Chronic stress can lead to irregularities or even the temporary cessation of your menstrual cycle. It's not just psychological stress. Physical stress like illness or rapid weight loss can have the same effect. Managing stress through techniques like mindfulness, yoga, and adequate rest can help normalize your cycle. Remember, it's not just about feeling stressed. It's about how your body perceives and reacts to these stressors. If you are enjoying the video so far, please like and subscribe. Moving on to the next reason. Number 2. Sleep disturbances. Our sleep patterns have a more significant impact on our menstrual health than many realize. The circadian rhythm, our body's internal clock, regulates the release of hormones, including those that control the menstrual cycle. Menstrual irregularities can result from disruptions in this rhythm due to shift work, jet lag, or irregular sleep patterns. Prolonged disturbances can even halt ovulation, causing missed periods. Studies have shown that women working night shifts or with irregular sleeping schedules often experience more menstrual irregularities compared to those with regular sleep patterns. Establishing a regular sleep schedule and ensuring quality sleep can help in maintaining a regular menstrual cycle. Number 3. Being underweight. Body weight plays a crucial role in the regulation of menstrual cycles. Being significantly underweight, especially due to an eating disorder like anorexia or bulimia, can disrupt the hormonal balance necessary for ovulation and menstruation. When the body doesn't have enough fat, it cannot produce enough estrogen, the key hormone regulating the menstrual cycle. This condition, known as hypothalamic amenorrhea, occurs when the hypothalamus stops sending signals to the ovaries to ovulate. Gaining weight and treating the underlying eating disorder can help resume regular periods. It's crucial to approach weight gain healthily and gradually, focusing on a balanced diet and possibly seeking guidance from a nutritionist or healthcare provider. Number 4. Excessive exercise. While regular exercise is beneficial for overall health, intense exercise routines can negatively impact your menstrual cycle. Athletes, especially those involved in sports that emphasize leanness, often experience amenorrhea, the absence of menstruation. This happens because extreme physical activity can decrease the body's fat content to a level too low to sustain a regular menstrual cycle. Additionally, intense exercise can elevate stress hormone levels, further disrupting menstrual regularity. It's important to find a balance in exercise routines, ensuring they're rigorous enough for fitness but not so intense that they disrupt hormonal balance. Moderation is key, along with adequate nutrition, especially focusing on caloric intake to match energy expenditure. Number 5. Polycystic Ovary Syndrome, PCOS. PCOS is a common hormonal disorder affecting women of reproductive age. It's characterized by elevated levels of male hormones, androgens, which can disrupt the normal menstrual cycle. Women with PCOS may experience infrequent periods or prolonged menstrual cycles, and in some cases, their periods may stop altogether. This condition can also lead to the development of ovarian cysts. The exact cause of PCOS isn't known, but insulin resistance, inflammation, and genetic factors play a role. Symptoms include weight gain, acne, hair growth in male pattern areas, and thinning hair on the head. Managing PCOS often involves lifestyle changes like diet and exercise to combat weight gain and medications to regulate the menstrual cycle. If you suspect you have PCOS, it's essential to consult a healthcare provider for diagnosis and treatment. Number 6. Thyroid issues. The thyroid gland plays a significant role in regulating your body's metabolism and affects various bodily functions, including your menstrual cycle. Both hypothyroidism, underactive thyroid, and hyperthyroidism, overactive thyroid, can cause menstrual irregularities. Hypothyroidism can lead to longer, heavier periods or even cause them to stop, while hyperthyroidism can result in lighter, less frequent menstruation. Symptoms like weight changes, fatigue, hair loss, and temperature sensitivity are frequently present with these conditions. Thyroid disorders are diagnosable through blood tests and are usually treatable with medication. Regular monitoring and treatment adjustment are crucial for keeping your thyroid levels balanced and maintaining a regular menstrual cycle. Number 7. Medications. Various medications can impact menstrual cycles. For instance, certain psychiatric medications, like antipsychotics, can elevate prolactin levels, leading to irregular or absent periods. Hormonal contraceptives, particularly those with a high dose of progesterone, can also cause menstrual irregularities or stop periods altogether. It's a common side effect when starting or stopping birth control pills or using certain types of intrauterine devices, IUDs. Other medications, including chemotherapy drugs and antihypertensives, may also affect your cycle. If you've recently started a new medication and noticed changes in your menstrual cycle, it's worth discussing with your healthcare provider. They can help determine if the medication is the cause and discuss potential alternatives or solutions. Number 8. Early menopause or perimenopause. While the average age of menopause is around 51, some women enter this phase earlier, known as early menopause or perimenopause. This transitional period can start in your 40s or even earlier and is characterized by fluctuating hormone levels leading to irregular periods. Symptoms of perimenopause include hot flashes, night sweats, mood changes, and sleep disturbances. As you approach menopause, your ovaries produce less estrogen and progesterone, the hormones that regulate menstruation, leading to fewer and eventually no periods. If you're experiencing signs of early menopause, it's important to talk to your healthcare provider. They can run tests to confirm if you're in perimenopause and offer guidance on managing symptoms. Number 9. Excessive caffeine consumption. Caffeine, commonly found in coffee, tea, and certain soft drinks, can have more impact on your menstrual cycle than you might expect. High levels of caffeine intake have been linked to changes in hormone levels, which can affect the regularity and length of menstrual cycles. Caffeine can increase cortisol and adrenaline levels, which, in excess, can disrupt the hormonal balance necessary for regular ovulation and menstruation. It's also a diuretic, which can lead to dehydration, another factor that can influence menstrual regularity. Moderation is key. Limiting caffeine intake to a moderate level, typically considered to be 200 to 300 milligrams per day, about 2-3 cups of coffee, can help maintain a regular menstrual cycle and reduce other caffeine-related side effects like sleep disturbances and anxiety. Number 10. Elevated prolactin levels. The pituitary gland produces prolactin, a hormone primarily responsible for lactation. Elevated prolactin levels, a condition known as hyperprolactinemia, can disrupt the menstrual cycle and lead to irregular or absent periods. Causes of high prolactin levels include pituitary tumors, prolactinomas, certain medications, thyroid dysfunction, and kidney disease. Symptoms of hyperprolactinemia, besides menstrual irregularities, include milky nipple discharge, infertility, and decreased libido. A simple blood test can diagnose high prolactin levels. Treatment depends on the underlying cause and may include medications to lower prolactin levels, surgery, or radiation therapy for pituitary tumors. Regular monitoring and treatment adjustments are important for managing this condition and restoring normal menstrual cycles. Menstrual irregularities can be unsettling, but understanding these causes is the first step in addressing them. If you're experiencing missed periods, it's always a good idea to consult with your healthcare provider to determine the underlying cause and appropriate treatment. If you found this video informative and helpful, please share it to spread awareness. Don't forget to subscribe for more insightful content about your health and well-being. Until next time, stay informed and take care of yourself.